Now, the vaccination program has been affected, with sites damaged or forced to close for safety in the midst of violence and looting. This has affected the rollout of the program just as it was picking up. Let's get an update on that vaccine rollout and when it's going to start picking up again, given the current situation. Let's speak to the Deputy Director General in the Health Department, Dr. Nicholas Crisp. Dr. Crisp, thank you so much for making time. The President indicated that the vaccination rollout, as it was just picking up, has been severely interrupted by the current situation. Just give us an update on this disruption and when we are likely to see the resumption, especially in the areas most affected in KZN and Gauteng.
Evening or afternoon, Clement, and to your viewers. I think we need to be clear. The rest of the vaccination program in the rest of the country has not been disrupted at all, and in fact is picking up every day. And we're very happy with the increase in the number of people who are registering, the increase in vaccination sites, and the increase in the number of doses. Obviously, it's not possible in violence and war-torn parts of the country at the moment to provide a program. The staff can't get to work, they can't get around. People can't get to vaccination sites. We can't move our goods around to do that. And it's just not safe. So it's not reasonable in those areas to continue. So for those parts where there is violence, it will be suspended for the time being. And as soon as things calm down and people are able to get back to work, we will pick up with more vigor than we had before.
There are sites that have been housing some of the vaccines. Have they been impacted by the looting and destruction of property?
So fortunately, we keep talking about a pipeline. The pipeline means the vaccines, there are few vaccines in many places. So there's not a lot of vaccine that's all kept in any one place. And it's distributed all over where it's accessible for the vaccinators to use in the next day. So there are a number of sites that have been reported to have been damaged or looted. There are a number of private pharmacies in malls that have been destroyed. And surely the vaccines that were in those pharmacies have been either stolen or damaged, and in any case couldn't be used. We won't know the extent of that damage until it's possible for the owners of those premises, those pharmacies, to get back to work. In the public sector, we've been fortunate to have extremely little damage so far, and in any case in sites where there aren't vaccines. So for now, the vaccines are safe, and the disruption has been mostly in those few places that I've spoken about.
Yeah. Have you had to move some of the vaccines from other sites just to avoid there being an impact?
Well, there may be a need to move some vaccines around. As I said, if there are very small numbers, it doesn't make sense to do that. But where necessary, and if it becomes necessary, we may do that. We're obviously not going to talk about what we move around where. And although vaccines are an issue for us, all medicines are an issue for us, and we don't want them out in the general public space. They become useless once they're out there anyway, because they expire and they get exposed to the sun and the light and everything else and damages them. So our more important thing would be to say to the public, if somebody approaches you with a vaccination or a medicine that is not part of the official health delivery system by doctors and by the clinic structure, do not accept it, do not take it, it might be harmful to your health, and report it, please, so that we can follow up.
Yeah, should they report it to the police? And I suppose that's a very public and important public announcement, Dr. Chris, because some people may start approaching other community members to try and sell them some of the vaccines if that's been looted. So what should be the first point of contact? Must they approach the police?
So some people don't feel comfortable to report anything to the police, and especially now if there's been tension, that may be difficult for people to do. But they may report it to the police. It will be brought to our attention. We work with the law enforcement agencies. But if they're more comfortable to report it to our normal vaccine hotline, that would also be fine. Or they can report it to any of the health authorities or the private sector health providers that are available all over. Any of them. We work very closely together with everybody in the system. We will get the information and we'll be able to see what to do about it.